This podcast is brought to you by Meteorate.
Hi people, welcome to our podcast 16 of our seriously funny Wellbeing show. With me, as always, is the finest and bestest cardiologists, health experts on the planet, Dr. Ross Walker. Hi, Ross.
Yeah, I'd actually like to say the known universe. There's a guy in Alpha Centauri who thinks he's better than me, but I'm light years ahead of him.
Okay.
No doubt whatsoever.
And-
Look, I just wanted to tell you, I heard some disturbing news the other day, Homer,
Mhm.
that Mick Jagger and Keith Richards went to a friend's place for dinner,
Right.
and the friend and a number of people were there, and the friend undercooked the turkey, and everybody at the dinner got sick. So the man almost killed two stones with the one bird.
Beautiful dad joke to set things off. Ross,
Absolutely.
I'm continually amazed at the health statistics you throw at me, like the number of Aussies that simply don't exercise and eat the right food. So the most
75% of Australians and people living in the modern world don't do 3 to 5 hours of exercise per week, which should be 2/3 cardio, 1/3 resistance training. So only 25% of people do that, and it is the second best drug on the planet after happiness.
So the most recent statistics, Ross, show that almost 65% of Aussie adults and 25% of children are overweight or
Yep.
obese.
That's
And less than 7% consume a healthy diet. That's a bleak assessment of the latest 2024 scorecard on Australia's growing obesity epidemic. And it is an epidemic detailing a dangerous backside probably, on the fight, maybe a broad backside on the fight to improve nutrition and avoid chronic health conditions. So, Ross, if it weren't for the fact that the TV set and the refrigerator are so far apart, some Aussies wouldn't get any exercise at all.
Yeah, a number of people do no exercise. I mean, some of the 75%, people are still doing some exercise, but it's not enough to meet the guidelines that are given to achieve good health, keep your weight down, good cardiovascular health. And tragically, probably about 10-15% of people do nothing.
Yeah.
Absolutely nothing.
Another good reducing exercise consists in placing both hands against the table edge and pushing back.
Yeah. That's
So
it.
it is not only the quality of the food, but of course the quantity. And Ross, interestingly, what you eat in private will show up in public. Did you know
No
that?
doubt. No doubt.
So let's move on to medical news.
Yep.
Sleep and stress.
Yeah, this is an interesting thing and I found these statistics, some more statistics I'm throwing at you, that 80% of the modern population work in sedentary jobs. My job is
Yes.
toxic. I sit in my bum all day.
Yeah.
And that is toxic to do that. Now, 80% of people are now doing that. And this is a study out of the US, University of South Florida, where they looked at 1,000 people over 10 years and found that people who have sedentary jobs, which is obviously most of us, have a 37% increase in insomnia and a 66% higher likelihood of needing catch-up sleep versus people who have non-sedentary jobs. And we're not just talking, so when we're talking about good sleep, we don't just talk about having the suggested 7 to 8 hours of good quality sleep per day, which a lot of people don't have. So people who sleep less than 6 hours a day or more than 9 hours a day have a marked increase in health risk. But there's also now the concept of sleep regularity. So what time do you go to bed? What time do you wake up in the morning? Now, if there's an hour's difference either side of that quite often, so what we call sleep irregularity, that's also associated with a marked increase in obesity, cardiovascular disease, et cetera, et cetera, et cetera. So we should be striving for that 7 to 8 hours of sleep on a regular basis, going to bed at the same time, waking up at the same time. And this study is just showing beyond a doubt that our sedentary jobs and our poor sleep is having a huge effect on health.
Isn't it? So we almost need to find the sweet spot between energy expenditure, stress, and that actually quite often brings on sleep. If you
Oh, yeah.
probably sleep better, obviously, if you exercise well
Yeah.
and
Well,
look
we
at
had a full session on sleep a few podcasts ago, but
yeah
just to reiterate that, because it is such an important topic, my second key to being healthy, I'll just go through those quickly. Number 1 is no addictions. Number 2 is good sleep. Number 3 is good eating and less of it. Number 4, second best drug on the planet, as we've already mentioned, 3 to 5 hours every week of exercise, and most importantly, happiness. So if you want good health, you shouldn't be saying, "Oh, I'll just focus on exercise." You should focus on the whole damn thing.
yep
And so sleep is very important, and you want to try and get as good a sleep habit as possible, which means, again, going to bed at the same time, waking up at the same time, sleeping in a cool, dark room, get all electronics out of the bedroom. And as you're inferring, Homer, so rightly so, Dr. Papantonio, um, that the quality of your day will also determine the quality of your sleep,
mm,
and vice versa, the quality of your sleep will also determine the quality of your day. So sleep is a vital part of it. And I said in that podcast that we should really divide our lives into thirds. So a third of active energy, where you're out there working and doing your exercise, etc. A third of relaxation, and then a third for sleep
yeah
throughout every 24 hours.
and don't exercise too close to bedtime because
No,
it tends to keep you awake and blah blah blah.
yeah,
Future of medicine,
yeah.
prostate cancer therapy.
Yeah. Well, you see, at the moment, the treatment of prostate cancer is either to have your prostate ripped out with a radical prostatectomy, what we call brachytherapy, where they put little radiation beads in the prostate and that kills off the prostate, or to just watch it. And interestingly, a study out of the New England Journal of Medicine a couple of years ago looked at 1,500 men over the age of 55 with prostate cancer and followed them for 15 years, splitting them into those 3 groups. And they found that after 15 years, 97% of the entire population was still alive.
Right.
Whether they had their prostate ripped out, whether they had whether they had radiotherapy, or whether they were just watched. So 97% were still alive regardless. The only difference is the men who were watched had 3 times the rate of spread of the cancer.
Mm.
But when you look at people who've had their prostate removed, many men in that situation are getting incontinence, are getting impotence. Not all of them. Not all. Some do extremely well, but some don't. With the radiotherapy, there's often problems there as well. There's often some radiation proctitis, so men are left with chronic diarrhea with radiotherapy. But then, when you don't do anything, when you just monitor people to make sure that things aren't increasing, that still there is that higher risk, 3 times higher risk for spread. So we're always looking for better ways of managing prostate cancer. And here's something that I found fascinating, and this is again out of University of Southern California in the US, where they're talking about steam therapy for prostate cancer. I'm not talking about inhaling steam, that this would be delivered via a catheter into the urethra and onto the prostate. So they're talking about the fact that this steam therapy directed at prostate cancer cells may have the ability of killing off prostate cancer without a radical prostatectomy, and therefore without all of the side effects of all of the treatments we're
So
now offering.
what's the correlation with steam and the therapy? Does the steam actually, is it a temperature thing or?
Yeah, it's a temperature thing. So
Okay.
that the steam directed at a prostate cancer cell can actually kill the prostate cancer cells without actually destroying the remaining prostate tissue. So it's look, it's just being trialed at the moment. There's some evidence in laboratory animals that it works, but it has to be trialed in humans. So this is a study that's starting, and this is why I'm calling it the future of medicine. So if any men are listening to this and say, "Oh, I've just been diagnosed with prostate cancer, I want steam therapy," I'm sorry, it's not available. But it may be something that in the future becomes standard of care for prostate cancer. And also, there is for men who are listening to this who are tragically in the situation where the prostate cancer has spread into their bones and into other parts of the body. There's now a therapy that's becoming almost standard of care for that group of people, other than all of the medications that are moderately effective, such as hormone therapy or hormone blocking therapy. that's used and some of the chemotherapy agents. And this is called lutetium-177 PMSA. So PSMA, sorry,
Mhm.
PSMA.
Yeah,
Sorry, I get
that's
my
in
P's
English.
mixed
Yeah,
up,
yeah,
right?
yeah.
Yeah, so that's prostate-specific membrane antigen lutetium-177. Now, what that is they tag this nuclear lutetium-177 to a PMSA antigen, and it only seeks out the prostate cancer cells, so it's very specific for prostate cancer, and almost it's a payload delivered into the prostate cancer cell of the lutetium, so the radiation just only kills the prostate cancer cell. And there's been men who've had dreadful spread everywhere given this treatment, and it's just melted away the prostate cancer. So there's a lot of
Wow.
really exciting things happening in the prostate cancer space, and that's why I brought up this particular article.
So it's interesting with heat and temperature, even with exercise, how there's a heat exercise regimen now.
Mm.
Ice baths, recovery, temperature
Yeah.
does have a healing effect.
Oh, look, I don't think there's any doubt about that.
Yeah.
Swings in temperature are very, very important for the immune system. People, for example, who swim in water that's less than 20 degrees Celsius have much better immune systems. It's one of the treatments of long COVID is cold water swimming. That's very important. So, as you say, ice baths, heat, etc. There's a lot of benefits there. For example, in Finland, where they have a lot of saunas, a study was done on men. It was probably the same for women as well. It's just the study was specifically done on men. Men who had 3 saunas a week had a 30% reduction in cardiovascular disease. So, but I think it's not just the heat. And interestingly, with exercise, when you exercise, I think one of the keys for good health is what I call vasodilatation, which is opening up arteries. And so that's one of the benefits of exercise. It's pumping blood all around the body, less dementia because you're flushing out all the crap in your head by pumping blood through the skull. And that's why I think we've mentioned on the show before, drugs like Viagra and Cialis, which are not just good to give men good erections, but they're also vasodilators everywhere. They open up every blood vessel in the body and pump and flush all the crap out,
Well,
pump the blood through the body.
professional cyclists now are training. They're actually wearing jumpers and riding in heat, like on a hot summer's day. Obviously, they've got to be hydrated because they say there's a direct correlation to that and increasing your VO2
Yeah, yeah.
max.
So look,
Interesting, isn't it?
yeah, so it's heat, but it's also vasodilatation that's very important. So I just thought that was interesting.
Yeah.
Okay.
Body of evidence, cancer and aging.
Yeah, look, the greatest risk factor for cancer is being older. So if you're a 30-year-old heavy smoker as opposed to an 80-year-old non-smoker, the 80-year-old non-smoker has a much higher risk of lung cancer than the 30-year-old smoker, clearly. And why? Because they're getting older. But this is a really interesting study out of the Sloan Kettering Cancer Center in the US, which is one of the world gold standard cancer centers. And this showed that up to the age of 80, the cancer risk increases. But interestingly, when a person reaches 80 without cancer, then the cancer risk drops. Now, why is that? Because aging cells are different to younger cells. So I say all the time, Homer, and this is not a dad joke, but this is a dad comment, there are only 3 advantages of being over the age of 50. 1 is wisdom, 2 is grandchildren if you've got them, and 3, you lose the cancer risk for medical radiation. So, for example, if you go off and have a CT scan at age 35, you slightly increase your risk for a cancer 15, 20 years down the track. But once you've hit 50, the risk is absolutely minimal, if not absent, because your cells change. But as we get older and older, the cells change even more and they become even less responsive. It's a bit like we we're just talking about prostate cancer. There is really no point measuring PSAs in men over the age of 80 unless they've already had prostate cancer and you're just monitoring them. So if an 80-year-old says, I want to see how healthy my prostate is, you don't do a PSA, because if you take out the prostates of most men over the age of 80, you'll probably find little traces of prostate cancer in them, which will never cause them any issues at all. So it's best left alone and not even diagnosed.
It's
So
really
this is just
interesting, that whole cancer thing, isn't it? And aging, because we have got the chap who's the American version to yourself, Dr. William Liu, and he talks about eating to beat disease, and obviously you've written some stuff along those lines too. But
sure.
his main contention is that there's micro cancer cells that we all have, and that
Yeah.
the immune system's main role is just to zap them. And
Yeah, yeah.
and he talks about the role that diet plays in actually assisting in the zapping of those micro
Oh,
cancer
yeah, but
cells.
you see that I'm not deriding anything that Dr. Lou's done, but that's just damn obvious.
Yeah, yeah, yeah.
And the point is, everyone should be having 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day, and tragically, only 5% of people do that. And the reason we do that is not because it affects your cholesterol or helps you lose weight or anything at all like that. It keeps your immune system healthy.
Yeah, yeah.
And we're all creating every day little cancer cells mopped up straight away by the immune system. Damaged cells that aren't cancerous, but are still damaged cells, releasing what we call inflammatory cytokines into the bloodstream. Again, the immune system says that shouldn't be there, get rid of that. As we get older, especially if we eat poorly, ultra-processed foods, white death, which is refined carbohydrates, it pulverizes the poor immune system.
So do you think we'll ever get to the stage where the doctor of the future will be, instead of prescribing pharmaceutical drugs, will give you a prescription to the local fruit shop?
Well,
And
you're
so,
looking at a doctor who already does that. I tell everybody they
yes,
should be doing
yeah.
that. And so, you see, people say, "Oh, we shouldn't be eating this to prevent disease." No, but also we should be talking about what we should be eating,
Mm,
and that's where the fruits and vegetables should be the center of everyone's plate.
yeah.
And things like olive oil is one of the major components of the Mediterranean diet that really has strong health benefits. So it's all very, very interesting stuff.
It's a good segue into controversies and omega-3 supplements, Sarah.
Yeah, you see, and this is again a good segue into what we'll be talking about today. So that's why I had this as the semi controversies is that if you believe conservative people in the medical profession, and I certainly don't, they will all tell you all you get from vitamins and supplements is expensive urine. And yes, of course you get expensive urine, but you also get very valuable, expensive blood, which is exactly what you want. So what you don't need, of course, you urinate out. That's how the kidneys work. Whatever's excessive in the body, you either pass it out in your feces, or you urinate it out, or you sweat it out if you don't need it. But the question is, should or shouldn't we be taking supplements? That is the main topic for today. But this is just one study that was done on omega-3 supplementation. And they took 33 healthy, healthy volunteers over a 12-week protocol and gave them very high doses of a combination of EPA and DHA. And here's where a lot of people get it wrong. They take a fish oil capsule that's 1,000 milligrams, and they think they're getting omega-3. No, they're not getting 1,000 milligrams of omega-3. They're only getting 180 milligrams of EPA DHA. And there's been so many conflicting studies over the years to say that, oh, this stuff doesn't work, or that stuff does work, or this helps me, this doesn't help me. And I think the public has an absolute right to be absolutely confused and completely bombarded by all this nonsense. What I try to do is put it in some perspective. Now, this study showed clearly that what the omega-3, the big dose of omega-3, so you think
Yeah,
180 milligrams in one fish oil capsule,
yeah.
it's a hell of a lot of capsules you've got to take to get up to the 2.7 grams of EPA and DHA in this particular study. But what this study showed was that what the EPA DHA combination in a big dose was changing the LDL cholesterol. You see, and this is where we've spoken about this before. Everyone thinks LDL is bad, HDL is good when you talk about cholesterol. It's complete simplistic nonsense. LDL and HDL are divided into small bits and large bits, And here's where size is important. The larger your LDL, the larger your HDL, the better it is for you. What the omega-3s are doing are converting you from small LDL to large LDL, small HDL to large HDL, not really changing the cholesterol that much at all. And so this is showing that in these people that the change in the LDL caused much less inflammation in fat. And see, when someone has big abdominal obesity, it's not just an ugly lump of lard.
Yeah.
It's an inflammatory organ that's causing all sorts of problems. And this is showing clearly that the omega-3s are actually helping the inflammation and helping fat metabolism and helping generally carbohydrate metabolism in type 2 diabetes.
It's a big area, that whole omega-3, and the ratio of omega-3 to omega-6 is also important.
Yeah, it's very important. It's a good point.
Yeah.
Because you see, when you take a lot of omega-6, which are more the vegetable oils, and the worst thing is hydrogenated vegetable oils, which create trans fats, which are very much linked to heart disease. Not saturated fat. There's no link between saturated fat intake and heart disease. That's nonsense. It's been dismissed by a major study called the PURE study. But in fact, I wrote a book called The Cell Factor in 2002, where I said in that there is no link between saturated fat and heart disease, but there is a strong link between trans fats and heart disease.
Yeah.
And so when you have a lot of omega-3, you generate this thing called eicosapentaenoic acid, which then thins the blood, opens the arteries up. When you have a lot of omega-6, especially if it's hydrogenated, you generate this thing called arachidonic acid, which actually constricts the arteries and reduces blood flow and makes the platelets stickier, so you get more clots.
Yeah.
So it's good to have a much higher omega-3 to omega-6 intake.
And also the quality of the omega-3, quite apart from the mercury build-up, there's always been a bit of a controversy around.
Yeah, but you see, this is the problem. If you eat fish from the Northern Hemisphere, unfortunately, a lot of that fish has been caught in the heavy shipping lines. And so there's a lot of dioxins and methylmercury in those fish.
Yeah.
Fish from the Southern Hemisphere doesn't have anywhere near the same amount of pollution. And also when you have capsules that are Australian. So here's the problem. You go to America, their supplements are made to food standard. In Australia, our supplements are made to pharmaceutical grade, so there's no contaminants. That's the difference.
Yeah.
So that's what I say for anyone listening to this, whether you're listening to this in Australia or anyone else, anywhere else, the best supplements to buy are supplements made in Australia or New Zealand, because they're made to pharmaceutical grade and there's no contaminants in them.
Okay, so again, a good segue into what was subject of this week's podcast is vitamin and mineral supplements.
Yeah.
Micronutrients are also included in there, including vitamins. They play a pivotal role in maintaining overall health and well-being. So do you want to take it away from there?
Yeah, I do.
Ross?
And look, I want to put this in perspective, and we have spoken about this on numerous occasions, but I think repeating something that's really important is vital.
Yeah.
So eventually it sinks in. Everybody's management homer is what I call 80-10-10.
Yep.
80% of those 5 keys that I've already mentioned, and that should be not negotiable for anyone. And I've been doing my job for 45 years, and I know the people who do the best in my practice are people who follow the 80-10-10 rule. So, and tragically, only 10% of people practice those 5 keys. Only 10%.
Yeah.
10% is the appropriate use of pharmaceutical drugs if you need them. And the final 10% is the appropriate use of supplements. Now, I'll be talking with you in the next podcast about how to reverse heart disease. And it's the same thing. It's 80-10-10.
Yep.
But I'll get on to the key points there when we get to that podcast. So what is the 10%? Should we be supplementing? So I believe, look, if you live to your physiology, you don't need to supplement. So what's living to your physiology? Living for 30, 40 years, wandering around a jungle with a spear. Of course you don't need to supplement that. You're going to be dead by 40. What's the point of taking supplements?
Yeah.
But no one lives like that anymore. We live in a completely different environment. We don't live in a natural environment when we're eating natural foods. We're moving all day to get food. The food's not always available, so there's the acute feast to the kill, and there's a couple of days where there's not a lot of food available. So there's a bit of famine for a few days. So everything's feast and famine, constant movement. The only stress you had in those days was the acute stress of the kill, or the stress of avoiding being something else's lunch. But it sucks being a hunter-gatherer, say, and you live 30, 40 years because you have your head ripped off by a saber-toothed tiger, or you die of some infection. Let's bring in the modern world. We have exposure to food all the time. So breakfast, lunch, dinner, sitting our bums all day, it's no wonder we get overweight. Excuse me, that was too much talking.
Yeah.
We live in a world that is full of synthetic chemicals. So not just the synthetic chemicals in our food, just go outside and take a deep breath in any city. You're taking thousands of microdoses of synthetic chemicals into your lungs all day. The things you wash your clothes in, the chemicals on your plate and the dishwasher, etc., etc. There's chemicals everywhere, and we're not supposed to be exposed to those chemicals. So we've got the chemicals, we've got an obesogenic society, we've got a sedentary society, a society where we're also being exposed to small doses of radiation. So you and I at the moment are sitting in front of computers, and it's been estimated that just by modern electronics and travel, we get exposed to mainly maybe around between 5 to 10 chest x-rays every year of radiation, even if you don't have any radiation from an x-ray. So it's 5 to 10 chest x-rays as well. And also we have chronic stress. So we're woken up in the morning by a thing called an alarm clock. So the alarm starts the second, bing, 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 bing. You're awake, and the stresses go through the day. The stress of travel, the stress of complex jobs, complex relationships. So that's not how we were designed physiologically to be. So what I'm saying is that don't say, oh, you get all the nutrients you get from your food. And we've already mentioned only 5% of people have 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day. So we might be getting macronutrients, which is fat, sugar, and protein, but we're not getting the micronutrients, vitamins, minerals, trace metals, which you get from your fruits and vegetables. But because of all of the extra stresses of the modern world, I think it's important to supplement. Now, this particular study that just came out late last year showed, for example, in the global population, 68% of the global population deficient in iodine, 67% deficient in vitamin E, 66% deficient in calcium, 65% deficient in iron, and greater than 50% inadequate intakes of riboflavin, that's vitamin B1, folate, vitamin C, vitamin B6, and low levels of B3, thiamine, and selenium. So I've just quoted a few of the vitamins and minerals and trace metals that we're not getting in a normal diet. And this is a global view of what's going on around the world.
So excuse my ignorance for a moment, but does the pharma companies, do they have a patent on vitamins?
No, not at all.
They don't.
No one has a patent. And see, here's the problem. When a pharmaceutical company discovers a new drug that might do X, they have a patent on that, and then they spend millions, sometimes billions of dollars to develop that drug to market. And then they put it on so they have to then do a randomized controlled clinical trial, which costs millions of dollars to do. So to develop that drug is incredibly expensive. And so what they do is they take, say, 5,000 people, they follow them for 3 to 5 years, give half the active ingredient, half the placebo, and then at the end of the time they say, okay, we've looked at this, and of the 5,000 people, 150 had a heart attack on this pill, but 190 had a heart attack who were taking placebo. Therefore, there was a 30% reduction in heart disease, or whatever. I'm just making these numbers up. And that 30% is a relative risk. So it's not as if 30% of the population had a heart attack and and 70% didn't. Nothing like that. It might be a 2 or 3% risk of a heart attack, and the 30% reduction is a 3% risk down to a 2.7% risk. But the 30% makes it sound more dramatic. Now, with vitamins, minerals, and trace minerals, there will never be and has never been randomized controlled trials to that level. There is one or two exceptions that I'll bring up. But I don't believe you need the randomized controlled trials at that level of hard events with vitamins, minerals, and trace metals because they're food supplements. They're not heavy drugs that can have a heavy pharmaceutical and synthetic effect on our body. They're just really enhancing what you get in food. That's why we call them supplements. They're supplements to a healthy lifestyle. So, for example, they did a study where they looked at 1 million people taking supplements. And they found that there was about, on average, for people taking varying supplements, around a 20% reduction in different diseases. So that's relative risk reduction, except for in the overweight people or the smokers. So if you're fat or you smoke, don't take a supplement and think it's going to compensate because it doesn't work. So you have to use the supplements as a supplement to a healthy lifestyle. End of story. So what should you be taking, in my view, and why?
But before you go on to that, essentially what you're saying is that vitamins are like an insurance policy for yourself, essentially. And I like the analogy you draw between the racing car and the bicycle. The motor car represents the pharmaceutical industry. It'll get you there fairly quickly, but might explode when it gets there.
Oh, no, you could crash and kill yourself. That's why you must have seat belts and you must have safety mechanisms in the car and you must have road rules to make sure you drive carefully. That's what the pharmaceutical industry is, whereas the supplement industry is like a bicycle. A to B much slower, but the important thing is just keep away from cars, wear a helmet, and just be careful when you drive, and you get the extra benefits of the exercise. But you don't need the same heavy rules that you need for a car. But
it'll get you there eventually, but take longer.
And that's the key. So let me then say, well, what should people be taking? And we had a whole segment a few months ago on the MTHFR gene, which affects 50% of the population and is really important in generating high-quality DNA, high-quality RNA, high-quality protein, which are all the building blocks of how the body works. But see, here's the problem. Old-style multivitamins were based around standard folic acid, which doesn't work in this situation because imagine there's the MTHFR gene directing the high-quality DNA, RNA, protein. Folic acid just bumps into the MTHFR gene and can't get beyond it. So you then can't generate those high-quality things. That's why I believe from about age 30, everyone should be taking a high-quality multivitamin that has in it fourth generation folic acid, which I cannot say on a public what the name of the stuff is, but it's the 5'-methyl tetrahydrofolate glucosamine salt. And there's tragically only one multivitamin in Australia that has that in it, or you can buy that glucosamine salt by itself. Now, I'll give you a very, very personal example of me. I have the worst mutation in the MTHFR gene called the C allele. I'm homozygote for the C allele, which means my mum and dad gave me the two worst alleles, mutations in this gene. So unless I take this fourth generation folic acid, my folic acid bumps into the MTHFR gene, just builds up in the bloodstream. And when you get into your 60s and 70s, that folic acid can be toxic to your immune system unless you take the one that I'm taking. So I think we should just scrap folic acid as a supplement and go to multivitamins that all have this glucosamine salt. Now,
can you derive that folic acid from a natural food source?
Of course you can. No, you derive folate from fruits and vegetables, especially leafy green fruits and vegetables. And that's a good thing to do as well. But I'm saying, especially if you're in my situation, when you're one in two people who have that mutation, you must be taking this high-quality folic acid. So to me, there is only one multivitamin in Australia that people should be taking. I can't say the name of it. Sorry.
Okay.
But you can send an email in to us and we can give you the name of it. Okay. So so from age 30, we should all be doing that for the rest of our days. So what's my evidence that it even works? There's a little-known university in America called Harvard. And Harvard have been doing for the last 30 years the male physicians trial, the women's health study. And the different with these studies, they've looked at all aspects of health. So whether the people live the right sort of lifestyle, whether they take supplements, whether they take medications, they've just followed their health for 30 years. The sub-study that looked at multivitamins basically showed, and this is even the old style folic acid, people who took a multivitamin every day up to 10 years did absolutely nothing. But when you started to look at the data beyond 10 years, and this was a randomized controlled trial in the men, up to 10 years, an 8% reduction in common cancers and cataracts. Now you go, 8% doesn't sound much, but when you're looking at 40,000 men over 10 years, 8% is still pretty good just by taking a simple harmless multivitamin every day.
Yeah.
Then they looked at the observational data in the women at 15 years. So I think it's something like 80,000 women at 15 years who did or didn't take a multivitamin for 15 years showed a 25% reduction in breast cancer, 23% reduction in cardiovascular disease, and wait for this one, a whopping 75% reduction in bowel cancer in the women who took a multivitamin every day compared to the women who didn't take a multivitamin every day. Now, the argument used there by some doctors, and I think this is flawed, is that the women who took the multivitamin, it was just a marker of being more health conscious. So if they're conscious enough to take a multivitamin every day, they'll be more conscious to exercise and eat better, etc. But so what?
Yeah.
Do all those things and take the multivitamin and get that 75% reduction in bowel cancer. It's a pretty good result. Then they looked at the 20-year data in the male doctors taking a multivitamin every day. Now, which anally retentive neurotic would take a multivitamin every day for 20 years? You're looking at one, Homer.
Yeah. And
they found that in those doctors who did that, a 44% reduction in cardiovascular disease just by taking a multivitamin every day.
So would you agree that the primary source of your vitamin and minerals has to be from diet and food?
No doubt.
And then as an extension to that, it's almost like, again, like an insurance policy. You've got to take a specific amount of vitamins and minerals that are almost empirically proven to work over time.
Yeah, but over a long period of time. But you've got to do it
long
every day.
period of time.
And don't ever see them as a replacement. They're called supplements. What are they supplements to? A healthy diet. So that's the first thing, multivitamin from about age 30. And I think around age 30, taking some form of omega-3. So again, there's a little-known institution in America called the Mayo Clinic.
Yeah.
And the Mayo Clinic have been publishing a lot of incredible work for many, many years. In the Mayo Clinic proceedings a few years ago, they did a meta-analysis of all the omega-3 studies, and they showed that up to 5 years, taking omega-3s every day didn't do much for most people. When they looked at the data beyond five years, there was about a 20% reduction in cardiovascular disease. So I think from about age 30, you should be taking some form of omega-3. Probably the simplest thing to do is take a krill, 1,000 milligrams a day, but whatever suits you, I don't care as long as you're taking something. So that's 30. So when should you start taking other stuff? Well, I think in my very biased view, and I do the research on this, and I'm an honorary Calabrian citizen because of my services to the bergamot fruit, everyone should be taking a thing called BJE 100, which is a bergamot product. There are quite a few bergamot products on the market that don't cut the mustard, but this BJE 100 that I have an association with, so I've got to declare my interest here. I don't own the company, but I do all the research for the company, so I do have that association with the company. And we have published over 20 papers in the peer-reviewed literature showing the incredible metabolic benefits of this bergamot product, the BJE 100. So, for example, what that does have a profound effect on cholesterol. It doesn't lower cholesterol levels. It converts you from small LDL to large LDL, small HDL to large HDL, reduces your risk for diabetes, fatty liver, Alzheimer's disease, and it also suppresses cancer stem cells from a study published out of the University of Manchester, not our lab in Italy. So that has enormous benefits. And I think from age 50, everyone over the age of 50 should be taking that particular BJE 100 twice a day. I can't mention the product, of course, for the rest of their life.
Or eat more mandarins and oranges.
No. No, you should also have mandarins and oranges,
Yeah.
but there is not the polyphenols, plant chemicals in standard oranges are in small doses compared to the huge doses in the tablets that you
Okay.
take, the BJ 100. So that's there. So what about anything else? Well, that's entirely up to what's happening to you over the age of 50, because you see, one of the things that happens at age 50, is the hormones are going south in men and women. And then after your hormones go south, the risk for degenerative diseases starts to increase. Heart disease, cancer, Alzheimer's, osteoporosis, type 2 diabetes, etc., etc., etc. So then you look at specifically where your issues are occurring. So, for example, many people in their 50s, 60s, and 70s are getting high blood pressure. So there is a supplement called kyolic garlic. 2 capsules of that in the morning. I can't mention the product, but 2 capsules of that in the morning can help control blood pressure. A mate of mine called Matt Budoff, who's probably the top preventative cardiologist in the US,
Yep.
he did a study on 4 capsules a day of kyolic garlic, and he reversed heart disease, pulled the fat out of the arteries. We were talking about that in the next podcast. So a couple of kyolic garlics in the morning. Then you look at, say, something like osteoporosis. People who are starting to get osteopenic, and 25% of postmenopausal women, 5% of men over the age of 65 have a degree of osteopenia or osteoporosis.
Yeah.
And so people say, well, what about taking oral calcium in the form of calcium carbonate? Well, there's no evidence at all that that helps osteoporosis, stops bone fracture, but vitamin K2 in a dose of 180 micrograms a day takes the calcium out of your arteries and puts it back in your bones, and keeping your vitamin D levels around 100, because a third of Australians have vitamin D below 50, that also helps for osteoporosis. Now, one of my favorite supplements is a thing called ubiquinol. Ubiquinol, 150 milligrams a day, is the active version of coenzyme Q10. And all patients say taking a statin drug, and that's 1 in 3 people over the age of 45 in America, for example, are taking statins. Statins pulverize coenzyme Q10 levels in the mitochondria. The ubiquinol helps counter that.
So interestingly, Ross, I look at it a little bit differently. You look at it from an age perspective. I look at it from me being a health nut, from an activity perspective, the amount of strenuous exercise that I do, and all those supplements you mentioned, I think are beneficial to me without going to, like, Meryl and I were watching this thing on Netflix yesterday about this guy in America who just is a squillionaire who had just gone completely overboard with the amount of vitamin, that everything, he gets everything tested. And I'm just looking at this and saying, get a life, mate.
That's what I say to my patients. You should be smelling the roses, not analyzing the damn things.
But interestingly, but what you were saying there about, like, I take kyolic garlic. I take 4 tablets a day. I take coenzyme Q10 because of the effect it has on.
Hopefully ubiquinol.
Yes. Vitamin K12 I take.
K2, not 12.
Sorry, K2. Vitamin C, magnesium, and of course, the jury's not out with omega-3s. I'll take a combination of krill and fish oil. Which because of the mental benefits too. Improving mood.
There's enormous benefits with all these things, but as I said right at the start of this discussion, it's still only 10% of your management. Don't see it as the key. And I'll finish off, because I could keep going for hours on this. We haven't got time, but I'll finish off with a story of a woman came in to see me, and Homer, as you know, I'm not known for my subtlety, and this shows you how completely unsubtle I am. So this woman came to see me, and she was telling me she was treating her endometrial cancer with apricot kernels. She also went on to tell me that she refused to take blood pressure pills despite the fact that her blood pressure was very high. Then she plonks 20 supplements on the table and says, "But doctor, I'm taking all of these," as if this was a badge of honor. And I said, "Let's talk about the elephant in the room, you," because she was morbidly obese.
Okay.
And I mean, really, the supplements, she's refusing good medical therapy for her blood pressure and endometrial cancer, but she thinks the supplements are going to be a savior. That is medical nonsense. So what is the savior to everybody? And I'll finish off with this because it's a really important message. 80% how you look after yourself. 10% medical therapy if you need it, and many people don't and are still given pills when they shouldn't be, and 10% supplements. So the supplements are there as a good supplement to healthy living, but don't ever forgo the healthy living.
But
That's the important
okay,
thing.
but I've got to ask you, if all things being equal, and you had patients that were just say at a certain level of fitness and everything else, if you were forced to not administer any pharmaceutical, intervention, could you have a similar effect purely by prescribing vitamins and supplements? Would it
No,
just take longer,
no,
or it just
no,
wouldn't
no,
work? How,
no. Look, I say all the time, vitamin supplements make healthy people healthier. But people with diseases, it makes the medical treatment work better. That's my view.
yeah,
But all of us, whether we have a disease or whether we're very healthy, should be practicing those 5 keys. That is the key of everyone's management. The others are adjuncts to that. So a healthy lifestyle, 4 times more powerful than any pharmaceutical preparations or medical intervention or any supplements you can take. So no, I would never see supplements as a replacement for appropriate medical therapy. The concern I have is that many people, in my view, are being given inappropriate medical therapy who don't need it, but there are many people who do need pharmaceutical drugs and don't ever walk away from that. That is irresponsible.
yeah. And in emergency situations, drug intervention, you don't go spraying alfalfa sprouts for someone who's at a
Yeah,
cardiac. Yeah,
I say this all the time. You're having a heart attack.
yeah.
Don't sit there and meditate or go to your naturopath. And I'm not knocking naturopaths. Get to a hospital, get a stent in. That's the management.
Okay, that was very interesting, and it certainly it's a big area, isn't it, that whole.
Huge.
But so we've got questions from our listeners. We've got Brian from Noosa asks, "I've heard that we all have micro cancer cells floating around in our body, and our immune system zaps these at a microscope." We spoke about this before. At a
Yep.
microscopic level before they get bigger.
Yep.
So can we use food as medicine to bolster our immune system? And how does the immune system do this?
Yeah. Well, we've already answered the answer. It's a definite yes.
Yep.
How does the immune system do it? Very, very straightforward. There is, I say all the time that well over 90% of illnesses start in the gut. And almost everyone living in the modern world has a degree of gut dysbiosis. So we have about 40 trillion human cells in our body and somewhere between 40 to 100 trillion bacterial cells. So you've got to have a symbiosis between those two things. So when you have your fruits and vegetables, what you're doing is you're feeding healthy food into healthy gut bacteria. When you have your ultra-processed crap masquerading as food, or your white death, the refined carbohydrates masquerading as food,
Yep.
you're feeding sugars and synthetic chemicals and killing off the healthy bacteria and bringing in pathogenic bacteria. So the way your immune system is improved, because 70% of the immune system lives in the gut, is by creating healthy gut bacteria that feed healthy prebiotics, which is the food that the bacteria eat, the probiotics, which are the healthy bacteria, and the postbiotics, which are the chemicals secreted by healthy bacteria that then work to make your immune system then release all of the important chemicals that help them kill off the cancer cells and the invading pathogenic bacteria and viruses, etc. And interestingly, during the COVID pandemic, I said right from the start of the pandemic and all through the pandemic that what COVID was doing in the vast majority of cases were tipping people over the edge who were already on the precipice. So COVID hit the extremely old, the extremely ill with other conditions, and the extremely fat, people who are very overweight. They're the main people who develop COVID. Now, sure, people are going to say, oh, look, I had a 30-year-old brother who was incredibly thin and healthy and did all the right things and got dreadful COVID, and now he's got long COVID, etc. Yeah, that occurs rarely. But 95 to 98% of people who develop severe problems with COVID, very old, very sick, very fat.
So
And
to what degree do antibiotics wipe out gut bacteria, and how quickly can this gut bacteria be restored?
Yeah,
Because-
antibiotics wipe out gut bacteria very quickly. And the more antibiotics you have, the more damage your gut bacteria is. That's one of the reasons why most people have significant gut dysbiosis. But if you then continue with your fruit and vegetables, which again, I'll tell you another story. I had a man who came to see me with a 30-year history of chronic fatigue syndrome. And so he'd been managed by doctors for 30 years. And I said to him, look, you've got serious gut dysbiosis. We need to fix your gut up and hopefully that'll help your fatigue. So the first thing we need to do is get you on to 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables a day. Oh, doctor, no, I don't like fruit and vegetables. And I said, what? He said, oh, I don't eat them. I just don't eat them.
They're sucking the sab, yeah.
So, I mean, what can you do? If he's not prepared to do something that's going to make him feel better. I mean, the guy drags himself out of bed every day and drags himself around in life. And he refuses to do the best therapy here, which is the fruit and vegetables. So you can, and I think this is a general principle for all conditions, all trauma to the
But
body.
what do you say to that guy? Do you say to him, look, you're going to die? You're going to die?
No, I don't say you're going to die. I just say, look, this is my advice to you. It's your body. You do with your body what you like.
Yeah.
Walker rule number 2 of medicine is the patient's the one with the disease. It's not my problem. It's not my problem. It's their problem.
Yep.
I give them advice. If they don't want to listen, that's their issue. So no.
No, but
So
what about fecal?
And let me
okay.
just finish what I was going to say.
Yep.
That this is a general principle for everyone listening. When you have any insult to your body, whether it's antibiotics, whether it's a serious illness, whether it's an operation, it takes your body about 3 months to get over that.
Yeah.
Whether it's COVID. So when I have a patient's bypass, I say to them, after about 3 months, you can start swinging a golf club, but 6 months you can swing an axe, not because of your heart, but to get the sternum healed.
Yeah.
But it takes any insult. So you get pneumonia. Like a mate of mine who's a professor of medicine had pneumonia, and after 2 months he was still feeling lousy. He said, Ross, I don't get this. He said, I had pneumonia 2 months ago. I said, hang on a minute. It takes you 3 months for your body to get back to where it is. So if you've had any insult to your body, don't expect that things are going to repair under 3 months. So fruit and vegetables, tribiotics, which is the best way of doing it, on top of the fruit and vegetables, and avoid all the toxins like the ultra-processed foods, etc. And here's another thing. I'll throw in the hygiene hypothesis. This whole world has become too sterile.
Yes.
Always these stupid hand sanitizers. And look, when you go to the bathroom, you should wash your hands when you finish at the bathroom. They did a study at an infectious diseases conference, and they put these medical students as the toilet orderlies, just, pretending to be there, and they were taking a survey of how many infectious diseases doctors wash their hands after going to the bathroom. 30%.
Yeah.
Outrageous. So you go to the bathroom, wash your hands with soap. You don't need the sanitizer. Wash your hands with soap. Sing to yourself in your head, happy birthday. By the time it takes you to have happy birthday, that's how long you should be washing your hands for with soap. But these sanitizing nonsense completely changes the healthy gut bacteria.
Yeah. And very quickly, fecal. How do they for healthy gut bacteria? Because there's another doco on Netflix at the moment about this lady going overboard about how antibiotics destroy your system, and the only way of restoring it to its full glory is to somehow orally take fecal. How do you?
No.
How do you do it?
No, it's called fecal microbiome transfer.
Yes.
Transplant.
Yeah.
And what they do is a healthy young donor donates their feces, and then via a colonoscope, so they go up the backside, via a colonoscope, they deliver the payload into the colon, or they're now developing these very hardcore capsules that obviously that don't break down until they get into the colon, that you can't taste, that you can swallow as well, that are full of fecal healthy bacteria. So that's how they do it.
And is that the way of the future?
Yeah, well, it's being, for example, there's a thing called Clostridium difficile, which is a very nasty antibiotic-associated diarrhea. So antibiotics kill off the healthy bacteria that Clostridium difficile grows in.
Yeah.
And they're using a fecal microbiome transplant to cure it. It's probably the best treatment for it.
Okay. Last question. I'm 63-year-old female concerned about my breast cysts that have just popped up. In fact, 6 or 7 in each breast. Is this common?
Oh, very good. Yeah. Breast cysts are incredibly common, and they just need to be monitored, regular mammography, just to make sure there's no evidence of underlying cancer. But there's no association between breast cysts and cancer, just that breast cancer is relatively common. 1 in 9 women get breast cancer throughout their life, and breast cysts are very common. Probably it's the same proportion, but it doesn't mean breast cysts, breast cancer go together. They don't.
Okay. And I think that winds up this
It does.
this session. Have you got a farewell joke by any chance?
A farewell joke. Yeah. Look, this is a beauty. So at a restaurant, a woman says to the waiter, "Look, we don't eat eggs, meat, fish, dairy, or gluten. What would you recommend?" The waiter says, "A taxi."
And on that note, it's bye from me, and
bye from me.
Thank you.
Hello, listeners in Australia. I've got a big secret to let out about my good friend, Homer Papantonio, the corporate imposter. He's the best speaker I've ever heard. I only deal with the best. He's a great athlete, great cyclist too. And the real reason he's the best is that he uses the best omega-3 supplements on the planet, produced by Zinzino. Homer needs to perform at his absolute best on and off the stage. That's why he takes the best omega-3 supplement on the planet.
Well, yeah, I know about Homer taking Zinzino Omega-3. I've been using it too. It's derived from highest quality ingredients from all natural sources. These Omega-3 balanced oils are molecularly tested for toxins to ensure only the purest and freshest ingredients are used. You can even have a blood test to see what your Omega-3 status is.
Oh yeah, this Omega-3 from Zinzino is the single most scientifically supported supplement on the planet. And the health outcomes are big, really, really big. It's an absolute no-brainer for every man, woman, and child. It's the best, the biggest, and the best. And you can buy it at zzomega.com. zzomega.com.
Like Homer, I've been sucking on Zinzino Omega-3 capsules and solutions for the past year. It helps reduce Alzheimer's and dementia risk, inflammation, mood, improve sleep and immunity, and the list goes on and on and on and on, like you do.
Don't worry about it. Well, Zinzino Omega-3 is the best. I only deal with the best. Go to zzomega.com. That's zzomega.com. Simply the best.